Okay, I'd like to welcome all of you here for this, what I hope to be, and I think will be, certainly will be a very interesting event, very informative for you. You should all take notes. A lot of data is going to be given to you. I am Rafael Fierro. I teach political science and history here at Tunxis. I also lead the Civic Engagement Institute, which is sponsoring this event. It's a campus organization devoted to getting all of you more involved in our communities, more civically active. And we hope that events like these inspire you to do that. I'd also like to thank a few people. Cliff Sargis helps me direct the Civic Engagement Institute, always helps me out, and is very much attuned to what we do here, and he can read my mind, and he's always one step ahead of me. So thank you, Cliff. I appreciate it. Marie Klukas, she teaches sociology here. She's actually responsible for putting this event together, so I appreciate all her efforts. This is always a team effort, and we applaud faculty members and administrators who lend a hand and who assist us. It's awesome. I also want to thank the administrators and faculty who are here. I will say that I know I'm preaching to the crowd, but we certainly don't get enough faculty participation in these things. So I'm speaking right into the camera, so whenever they see this event, they're going to know that I'm chiding them for not being here. But those who are here, I really appreciate it. So thank you so much. Our guest speaker today is Carl Asikainen. He comes to us with 20 years of experience working to address food insecurity and homelessness, in particular for the youth of the state of Connecticut. The age group of 13 to 24, he is most concerned about. And so many of you, of course, fall into that age group, and so you probably can directly empathize with the plight of the homeless and those who suffer from food insecurity. So this promises to be a very, very informative speaking engagement. He's worked as a food systems manager at a human service organization that lends aid and support to communities of Northeast Connecticut. Prior to that, Carl worked as an outreach worker for End Hunger, Connecticut. And he started his career in Philadelphia, where he observed, I forget what field you said you were working at a restaurant?
Yeah.
He was in a restaurant, and he noticed that there were lots of homeless people just kind of laying around, and on his way to work, he'd have to navigate through them. So he didn't do what 99% of people do, which was simply to ignore the problem and go about your business. He actually decided he was going to devote his entire career to helping those people who suffer from these kinds of misfortune. So I just applaud him on that level alone. I would say that he has done work that most of us, we don't bother to do. And so I'm very glad that he's here today. And so what he's going to do is speak about youth homelessness in particular, and he's going to open it up to questions and answers as he speaks. So feel free to engage him and have a conversation with him. So without further ado, Carl Asikainen.
Cool. Thank you for that introduction, Rafael. So thanks so much for having me here, Marie, and I'm just heartened to see a room full of folks. Thank you very much. It's a pleasure to be out of the office, right, and to speak with you all on this. It's a real important subject to me. Like Rafael said, I don't want to just talk to you the whole time. I have some slides on a PowerPoint, which I'll speak to when I get going. And I think it is ending youth homelessness. Cliff, if you would.
Absolutely.
Yeah, that's the freshest one. So I have lots of content that I can talk to, and I've been known to carry on speaking for ages. So please just stop me if you have a question, okay? Because I don't want this to be like top down the whole time. This is better if this is a discussion. But yeah, so I'll just say a tiny bit more about myself and about the agency that I work for, and then I'll jump on into the content that I have here today. But like Rafael said, I'm 21 years into this work around poverty and homelessness and justice issues. And I grew up in a really rural town in the northeast corner of this state called Pomfret. Anybody from the Northeast? Yeah? All right. Pomfret?
Close, but not quite there.
Not quite there, right? So very small, idyllic, right? Very small, like town center. Poverty certainly was around, but homelessness was not this visible thing for me growing up. Lived in some urban environments like Berkeley, California, and did a lot of schooling in Philadelphia. And street homelessness in Philadelphia really struck me. So I was actually pulling espresso in a little cafe, and the owner asked me to open, and the only thing he said was like, in the morning, there's a man sleeping on the grate right outside the door. You just have to kind of move him to the side to open the door and get the place started at 6 o'clock. And so I met an individual right in front of my place of business and started asking him, knowing him about his plight and experiences, and started to pay attention to street homelessness in Philadelphia, and became an outreach worker for Project Home, which has one of the only outreach coordination centers in the whole country for street outreach at the time. I didn't know really what I was walking into, but I ended up being kind of a mobile outreach worker, like bicycle-based, sometimes car-based, but often on foot, and responding to instances of street homelessness. There was a really punitive, without going really too far into the weeds, there was a really punitive law that had been passed by the city council in Philadelphia that was trying to address street homelessness by calling police and an outreach worker at the same time. So I was in that little cohort of outreach workers who got called with police officers to respond to people living on the street in front of businesses and engaging with them before police officers. So that was really where I got my teeth cut for outreach work and for understanding some of the experiences of people who are unsheltered and living on streets in an urban environment. So I ended up doing a lot with SEPTA, with the regional rail service, and being underground, and I ended up being in a lot of abandoned spaces and working in and through emergency shelters in Philadelphia. But the last 4 years, I've been with the Connecticut Coalition to End Homelessness, and very briefly, we're a 15-person statewide nonprofit policy and advocacy, technical assistance, and best practices organization that's all over the state, trying to train shelter staff, trying to train outreach workers, and working with housing providers to make sure that the system that we have established, that's good in some ways and weak in others, is working as best as it possibly can. So a lot of my work is focused on schools, secondary schools, a lot of high schools, so younger folks, which I'll get into here, and then also the continuity between secondary schools and colleges for young people who've experienced the housing crisis, and making sure that the terrain is as level as possible for them to access higher learning. So that's primarily my concern. There's a couple other things that I do, and I'll get to them here in this presentation. I think that's all I wanted to do for a preamble. Maybe we could just go to this first. So like I said, there's probably 10 slides here. Some of them have more words than others. I know that when words are on the screen, we lose focus, right, from me. So we don't have to go through all of these, like I said, but I'll try to speak to these words, but I won't speak to like every single piece of content here. But just in general, so when I say youth homelessness, what I'm referring to is individuals, unaccompanied youth, who are 13 to 24 years old. That's how the system is kind of defined here in the state. And we know, based on not only the work that we've done here in Connecticut, but nationwide around this issue, that youth homelessness is really hard to identify, right? Because young people are moving between maybe a lot of different places to stay at any given moment. And we also know that there's not a lot of dedicated services for young people, particularly minors, which I'll touch on a little bit, but in general for that population. And we also know that youth homelessness is largely rooted in family conflict. And I'll get to some numbers about how we know that and what we know about that. But the big picture here is that we don't have a good sense about how many young people, particularly minors, are homeless at any moment in the state. And we think that we have a better idea about how many 18 to 24-year-olds are experiencing housing insecurity and homelessness. But again, this is based on outreach, it's based on shelter enrollments, and it's based on places where services exist. And so part of my challenge here with you all today is to think about, and what I'm mostly concerned about, like the bottom line for me is like, how can we identify, or how can we say as a community that we're working as hard as possible to identify any young person that's experiencing homelessness at any moment? So in Farmington, how would we say as a community or a town that we know all of the young people, including minors, again, and not necessarily with families, or could be with families, but including minors, how can we say as a town, as an area, that we know all of the young people experiencing homelessness? It implores us to have a conversation with a variety of levels of institutions and to improve the system and kind of keep asking questions about, is this the best that we can do? And I'll just tell you, for minors, which is a big part of my work, this 13 to 17-year-old cohort that might not be in child protective services, child welfare services, we really don't have a good grasp on what that population is like or what that population looks like. So those are the challenges. That's like the bottom line for me, is how can we help communities and how can we help this institution understand the absolute scope of minor homelessness. So we're trying to end youth homelessness by 2020. If you've been on our website and you're paying attention to what Connecticut is trying to do as a state to address homelessness, when we say we're ending youth homelessness, or we're ending veteran homelessness, or we're ending chronic homelessness, it does not mean that no young person shall become homeless again. What do you think it means? What might it mean? Homelessness is going to occur again. Yes?
Well, from what I learned from the training that we went through going by that CCH conference.
Yes.
The end goal, yes, is to end, but logically it's not possible to strive to meet every person where they are at and help them and prevent them from becoming homeless in the future. It's not like this end all be all.
Right. Thank you for coming with us. We want to see a future where all forms of homelessness for any age population is rare, brief, and non-recurring. These are the words that our federal partners at the U.S. Interagency Council on Homelessness use, right? Rare, brief, and non-recurring. And saying that we're ending youth homelessness means that we've created the system that addresses it in those ways, right? So instances of homelessness that are occurring this morning at a secondary school in Farmington for a family that had, or an individual that had a disaster last night, is known to the greater network of people who are trying to address this problem, right? That's what we're trying to do. We're trying to be fast, and we want to make sure that anyone who's having a housing crisis is connected to services as quickly as possible, right? That's what we mean when we say we end homelessness. There's some other things that go into it, like how many people are coming into homelessness is rather exiting homelessness. Like we do a little bit of math in there But again, this is about data, and it's about the known universe of people that we are aware of that are experiencing these crises. So one thing that we do is, at a statewide level is, and that I'm kind of at the helm of, and I'll start to talk about this, and then I'm going to start to get increasingly anxious because it's a really big event. It's an annual survey. It's called the Youth Count, where for 7 days we engage with youth across the state, 13 to 24 years old. We give them a survey that's on an app, on a phone, and we ask them about 20 questions about housing and homelessness and what their experiences are. And we focus on schools, and we focus on youth service bureaus, and we focus on local YMCAs, and we focus on community colleges, and we try to get a sense. We ask every person that we see, not only those folks experiencing homelessness. Is there anybody that does like demography or statistics, right? So methodologically, not the most sound survey, right? Because we're asking the whole entire universe. But we're asking the whole universe because we know that that homelessness for young people is hidden. And we want to try to get to the point where we understand, and some of the questions on the survey are about how many times have you been homeless in the last, or without a place to stay in the last 30 days, in the last 60 days, in the last 6 months? Because we know that the experience of homelessness or housing insecurity it's episodic for young people. It's episodic for a lot of people, but particularly for young people. So the questions on the survey really try to get at that. What's been happening with you for the last year? Even though you're not homeless at this moment, how many times have you been unsure about where you're going to stay? And then how many times were you staying someplace that wasn't your own place where you didn't feel safe, right? Safety for young people, it's really, really important for anyone, really important, but particularly for young people. So the Youth Outreach and Count, we call it, is coming up in January, and there's going to be some more information about this here at the school. And I have some data specifically about what we've uncovered surveying colleges and universities in the state that I'll share with you, because I think that could resonate. If the rest of the content doesn't resonate with you, maybe this one will, right? And so we estimate, based on that last count, that there are around 2,500 homeless or unstably housed minors, the young people. I have some numbers on the 18 to 24-year-old, but I'm kind of focusing on minors here. So up to 17. An estimated 245 are homeless and 2,308 are unstably housed. So that means that they responded to that question about what was your experience like in the last 90 days or the last 6 months? They responded that it's been fitful, right? Or it hasn't been good, or it's been unsafe. And we've been surveying what year is it? It's 2020 is coming up. So 2019 in January, we were in 144 secondary schools and 54 elementary schools in the state, all over the state, and in about 30 colleges and universities, right? And then we were in shelters, and we were in adult education points, and we were in YWCAs and YMCAs and all of these other community places surveying. And now, as of Tuesday, around data, and I just welcome you to ask questions about data and how is it that we know what we know. But as of Tuesday, for the 18 to 24-year-olds, Connecticut has a statewide system where we have information around homelessness. We're one of the only states that has an entire statewide system dedicated to this. Other states have these like little brief areas, like Denver is really doing something positive. Berkeley, California has got something similar to this. Austin, Texas is really a leader. Madison, Wisconsin. So there's these different little areas that are also trying to track homelessness very closely. But Connecticut, we do this statewide. It's called HMIS, the Homeless Management Information System. And as of Tuesday, for 18 to 24-year-olds, we think, or our universe that we know of is there are 166 individuals that are known, some of them unsheltered, some of them in shelter, and 52 youth-headed families. So that's the head of household is 24 years old or under in the state. We know, what do you think about that? What do you think about that universe? Is it like, is that small? Does it like, oh, that's not that many? Or what are some reactions to that? There should be more, there should be less. What, yes?
I think there's gotta be a lot more hidden people.
A lot more kids in,
A lot more hidden people we don't know about.
ah,
I think there's so many more.
yeah. I agree. I totally agree. Right, there are centers where we have services and centers where we have outreach workers. They're usually urban centers, right? And so we know a lot about this small area. But then suddenly, outside of that area, we have the network kind of falls off and we don't know. And there might not be connections for young people to the system of services there. So I absolutely agree. This is our known universe. It's not adequate. We need to know more. We need to be better about this, right? Particularly for outreach and engaging with our partners, right? Both in schools and the Department of Housing, the Department of Public Health, the Department of Mental Health and Addiction Services, the Department of Developmental Services. Like, we need to really have some close conversations and memos of understanding with partners on all kinds of levels to get a gauge of exactly what the 18 to 24-year-olds look like, and then also particularly the minors, right? So I think that you're right. Yes?
Is the statistics you have taken the demographic of these kids' race, their household income, where they are, anything else, or just estimated?
So I have some specific things to say about race in one slide or two slides, but what was your next question, the second part of that? About?
Like their family, if they're a single mother, or if there's not enough income, if they have a family for themselves, if they take into account of that, or just a broad estimate?
So for folks who are within this system, we have a pretty good amount of information about them and about their disposition and about what's happening with the family at this moment, about things about income, things about housing, things about family size. Are all the kids with you? Are they apart? We know some things about the 18 to 24-year-olds and even families within 18 to 24-year-olds, not just individuals. But we don't necessarily use all that information at every moment. The information is not necessarily comprehensive, but there are efforts to work right with families who are in shelter to make it so that they can sustain housing outside of shelter. Right, that's one of the main goals. What we want to say too, as a foundation for the way that we talk about shelter, at least from the coalition and with our state partners, is that shelter should be very brief occurrence, right? We don't want anyone languishing in shelter or staying in shelter for a long time. We know that if you have entered shelter before in your life, the chances go way up that you're going to enter in shelter again, particularly if you were a young person, right? So you're kind of setting people up for failure in a lot of ways by allowing a system to exist like this. Sometimes we know that people need emergency shelter, and there are shelters here, but our work is to bounce people out before they even enter shelter. Doesn't really make sense, what I just said, but to really see if we can do any diversion for folks who are saying, I'm in crisis, I need to enter shelter. We have workers we're training workers now to really talk to them about other alternatives besides entering into shelter, right? Like, what could we do? Could we give you a small amount of money so that you could go back to an aunt or a family member or a positive person in your support network? Could we possibly do something like that rather than have you enter into shelter? Could we, where was the last place that you lived that was safe? Could we get you back there? There are some flexible kind of monies available within this system of addressing homelessness that get families or that prevent families from entering into shelter and that will kind of bounce them into something else supportive with supports around that. So it's a good question. Thank you. So maybe I'll go to that next. So to your point about how do we know what's happening, I was thinking, we've been thinking about this a lot as an organization, and what we have often, or what is occurring is there might be a propensity, or there might be a lot of services in a given urban area, like New Haven, for instance, where there's one of the only runaway homeless youth providers in the state. There's only 4 of them, but one of them, called Youth Continuum, is in New Haven. And there might be services in New Haven. So if you are a 16-year-old experiencing homelessness in New Haven, there's a dedicated team of outreach workers, and there's crisis beds in New Haven that are for you. You can only stay 21 days, but that's better than no days, and at least you're safe and off the street. Outside in Ansonia, which is not that far from New Haven, I think, the system is not that strong, right? So what we have is a lot of providers that are maybe dedicated or located in urban areas, and then in rural areas, the network is really weak. So we're challenged by this. In urban areas, there might be a wait list or a priority list to get into shelter. And in Salisbury, did I put Salisbury? I was thinking Salisbury. Oh yeah, Salisbury outdoors. But in Salisbury, or in this beautiful town, Eastford, in the northeast corner, has anyone ever heard of Eastford? Yes. Sorry, that was just a plug for my town. It's a cultural mecca. It's all swamp and ledge. Anyway, rural areas challenging for continuation of network. So we have people who might be outside, or young people who might be outside, that we just don't know about in Salisbury or in Eastford or in Falls Village, right? Or the northwest, the northeast corners, or Barkhamsted or Winstead, or other rural areas. We just don't know about them, and we don't have assessment points. So if someone was to call 211, which is the kind of way to access services, they might be asked to, if they called from Eastford, they might be asked to drive or get yourself 20 miles to do an assessment in Willimantic, right, which is just not practical. So this happens all over. And I just want to point out that there's a big disconnection between the services that are provided in Hartford and that might be provided in Somers or Ellington, right? And so how can we make this, the whole system, stronger? And I don't have an answer. I'm asking all you young minds about how do we make this stronger? Like, how do we really make the system stronger between the density of services that might be happening and the positive things that could be happening in urban areas, even though people are wait listed or priority listed there, and the lack of services that occur in rural areas? That's just a massive challenge. It's not just in Connecticut, it's nationwide, but we really feel this in terms of providing services to all homeless people, but particularly for youth, okay? So youth may not come forward to school support staff or peers, and the system of services for minors isn't adequate. So like I said, a lot of my focus is on this 13 to 17-year-old population that might not be with child welfare, with the Department of Children and Families, but might also be not with their family and at great risk. How can we as communities know the size of this population, and then what are we going to do to help them, right? That's my main concern. Thank you. Could we go one more? Who wrote these? So family conflict. I won't spend a lot of time on this, but I did mention that family conflict is a giant indicator for homelessness for young people. And so this first little bullet, 90% of runaway youth in shelters run by Family Youth Service Bureau, and 75.5% in residential programs reported family dynamics as critical issues leading to their homelessness. ironically, when we asked their parents what led to the homelessness, only like 8% of the parents thought it was a problem. Just saying, little slippage. So we know that conflict is a really big part of what's happening. Right? This is more of that. 41% of youth attribute running away to poor relationships with parents. Well, 7% of parents. I just said that, Carl. And then the National Network for Youth. Family conflict is the most common reason for a young person to be homeless. Yes, Raphael.
So you may touch on this a little bit later, but when you say family dynamics is a critical issue, can you just flesh that out a little bit?
So if a young person is questioning sexuality, for instance, one of the primary reasons they're asked to not be part of the family. It could have something, certainly this could have something to do with poverty, or dynamics, right? Other dynamics in the household, like young people escaping violence within the household. So we have this, we work really closely with the Connecticut Consortium Against Domestic Violence, CCADV. And for young people, there's a special consideration where if there's violence going on in the house between mom, dad, mom, boyfriend, whoever are the guardians in the house, if there's violence between them and not necessarily on the young person and the young person leaves, that young person is considered fleeing domestic violence, right? And domestic violence has some very specific laws around it. It's anonymous, it's very private for all these reasons. But young people who are in violent situations or witnessing violent situations in their houses, we realize that, well, we know that many of them are leaving because of violence in the household. And we've partnered with CCADV to make sure that there are resources for them, right? Yes?
Just a follow-up question. Does your data indicate whether a lot of that violence, or maybe a disproportionate amount of that violence, comes from a family in which there is a step-parent versus a traditional two-parent household?
That's a great question. And I haven't looked like close enough to see the composition of households for that, but that's a really good question. What we're looking at is like, what's happening in the household? Why is the youth leaving? The composition of the guardians, it's not secondary, it's primary, but I don't have that, like, I don't have that point like fresh in my mind, but that is a really good ask. Yes?
I figured it out.
Green.
Okay. Green for go. So when I was 18, my housing insecurity developed out of being under an oppressive parent who was mentally, emotionally, and psychologically abusive and manipulative, and just a toxic person in general. And that was really hard for me to live under, so that's where my housing insecurity came from, which leads us into defining domestic violence, which leads us into stopping the stigma about mental illness and how we perceive domestic violence, how we define it, how we like legally put parameters around that. Like, you're considered always their child, and so sometimes that role of authority, where I brought you into this world, you know, I can take you out kind of thing, is not always healthily shared with the child. So it's like they're never wrong, and that never really, that mindset personally for my parent, my dad, was like, has not left him. Like, I could have a PhD and he would still know more than me, even though he like only finished high school, which I'm not judging that. I'm just saying, like, there's so much mental, emotional, and physical, psychological abuse that's not defined as domestic violence because you can't see it and you can't prove it. And it's just like legally hearsay.
You're absolutely right. And I'm just happy to like say that for young people, we've expanded this definition where It doesn't have to be violence against a young person. It can just be the toxicity within the household and what's happening in the household. It doesn't have to be an act of real physical. It can be mental. This can be emotional. It can be controlling. It takes on all kinds of facets, right? But you're absolutely right. So thank you for sharing that. Thank you. Okay, I'm going to keep on going. I know I'm right on time. So, the count. I said some words about our count. This will be the 5th year. 2020 is the 5th year. It's kind of a big year for us. We're saying that we're going to end youth homelessness. That's a kind of a stretch, but we're going to try. But here are some of the results from last year from the count. And just so you know, I said this previously, but this is a survey. It's about 20 questions long. It lives on a phone or on a desktop computer. It's got some conditional logic in it, so if you answer a question this way, it might ask you a few more. Particularly if you were not housed at any point, it asks some more questions. So last year was our most successful year with the amount of surveys. We did 5,000 surveys statewide in 7 days. It's not that many, but it is actually a big state. So it's actually the most that any state has done. So it is a pretty good amount. And of these, 674 youth responded they were unstably housed at the night of January 22nd, because we go back to a particular night here. We're asking, what was your experience on this night, right before the youth count started? So 674 said they were unstably housed, and 185 said they were homeless, literally homeless, right? So that's 13 to 24-year-olds. And then we look at, this is in combination with something called the point-in-time count. Has anyone ever heard of the point-in-time count, the PIT count? Yeah? So nationwide, I'm probably going to say the wrong day. I think it's January 21st. It's that Tuesday in January. And the whole state, the whole nation, we count sheltered and unsheltered people that night. So we count youth in shelter, and we count anybody that we see outside. And then the youth count starts the day after that, and it goes for a week. But we keep referencing that night of the 21st of January. This year, because of the calendar, it's the 22nd. So this is about, we asked 5,000, we did 5,000 surveys in a week asking about January 21st. And of the ones that responded that they had some type of housing crisis that night, we asked them more questions, so the conditional logic kind of kicked in. And so I want you to pay attention to things. I've touched on some of this already, but over a third said that they had child welfare involvement. And we asked some follow-up questions about that. It's current. Many of them were current child welfare involvement. That means they're actively in DCF, yet homeless. Just want to throw that out there. And then some of them had previous Department of Children and Families experience and were experiencing homelessness or housing security. So we know that we're trying to work with our partners in child welfare very closely about how can we get better outcomes for youth who are aging out of foster care or out of your custody. How can we do this, right? We're trying to work, I'm working on the ground level and a little bit in the weeds to make sure that people are connected, but we have folks from the coalition and other partners who are working at the commissioner level, right, at the state, to try to make changes in how we work with DCF and how we can work with them to make sure that there are no releases to homelessness, because it's just unacceptable, right? A fifth had criminal justice involvement, right? 41% said that they could not stay where they are as long as they needed. This is what I always ask. We get calls all the time about youth who are doubled up. What should we do? One of the first questions is, and for your peers and for your friends who are experiencing this, is how safe? Is this a safe living environment? Do you feel safe where you are, right? 20% said where they currently were staying was not safe. So out of all those respondents, a fifth said that they were unsafe. And then race, we have to address race, right? This is something within our country that has a long legacy and has not gone away. And so people of color, young people of color in particular, are far overrepresented in young people experiencing housing crises, right? 37% identified as Black and 36% identified as Hispanic. There might be like some crossover there, the way that the Hispanic question is asked. But again, absolutely unacceptable. And we don't need to look, we've seen this data over and over and over. So the question is, what are we doing for young people of color in particular in this state to make it so that the terrain and the access to services is equal? Like, what are we doing? And that's a question I ask you, and that's a question that we ask ourselves at the coalition. How can we make this terrain more equitable for every person? And it's a struggle. And it's not just Connecticut. This is nationwide. The experience of unsheltered homelessness is predominantly on the, it's of people of color experience it far greater than whites. Pregnant or parenting youth, again, if you had to look at a population who chances are they were going to experience a form of housing crisis or homelessness, if you are pregnant or parenting as a young person, the risk goes up unbelievably. So we are constantly trying to work with the Office of Early Childhood, access to daycare, working with schools and Mckinney-Ventos to make sure that a senior in high school who has a child is still connected to services within the school and has the opportunity to finish school like their peers, right? We need to constantly work on that. 12% of them, of the respondents who said that they were struggling with housing identified as bisexual, and 6% as gay or lesbian, which is a tiny bit like lower than 2018, but not much. And then, so we need to pay attention to gender expression, to identity for young people as well, and work with groups who are trying to raise awareness about these issues in school settings and outside of school settings. But this to me is what I'm talking about. This 70% of youth that were homeless or housing unstable said they did not seek shelter. And so what that means is that, are they obvious to us? They're not in shelter. We don't know where they are. We know that young people don't seek shelter because, well, why wouldn't you go to shelter? Yes. Right.
Knowledge.
Awareness and knowledge.
Understanding, yeah, where you fit into that puzzle.
Why else would you, that's absolutely right. So you just don't know, as a young person, how would you know what the shelter system is like or what 211 is like? How would you know those things? That's absolutely right. Why else would you not go to shelter, though? Yeah?
For the people I met who experienced homelessness.
Yeah. So that's why I said wait lists, priority lists. He said that shelters were full within the Hartford area. There's, we were looking at this yesterday close for the city of New Haven. There's a 300-person, the wait list for shelter for men, actually for men and women combined, is 300 people deep in the city of New Haven. So that's 18 to 24-year-olds. It's not talking about minors, but for 18 to 24-year-olds in New Haven, there is a wait list that's really long. So if word of mouth spreads, like why even bother, then why would you bother? But why else? Are there any other reasons? Yes?
They might get afraid of the experience.
Yeah.
Shelter would be like.
Yeah, so afraid, right? Afraid, afraid of the experience of what the shelter would be. My experience in Philadelphia with, as being an outreach worker, I would engage with, it'd be 9 o'clock at night, and I'd be walking around the city. I'd find someone who was elderly, and I'd say, what are you doing in this doorway? We have to get you into shelter. And they're like, are you kidding me? Shelter? I'm preyed on in shelter. Like, it's young people in shelter. There's no way. So my experience when I was in Philadelphia, and this might have changed, is that folks were avoiding shelter mostly because of this reason. I mean, it was a capacity issue for sure, but it was also a risk and a safety issue, and that people had been preyed on within those environments, right? So there's lots of reasons why youth might not seek shelter. But I think knowledge is the biggest one, and this awareness of the way the system is supposed to be working, regardless of like wait lists or priority lists. Great. Can we do one? Oh, great. All right, so finally, some content about, I'm sorry about all these words up there. Well, I will share this with you, the PowerPoint. Sorry, I will share this with you. So for those of you keeping notes, you know, maybe that'll help. But so here's what we learned from asking questions for colleges and universities. 15% of the 296 students surveyed were experiencing homelessness or housing instability. What we know from this, we surveyed 2,000 college and university students. And so we had 300 of them that responded that they were experiencing homelessness. And I can like break those numbers down. I don't know if I did it for you here. Or housing instability on that given night. 31% of those respondents said they couldn't stay. So a third of them said that this was a time-limited feature of housing, right? They couldn't stay as long as they wanted. Nearly a quarter said that where they were staying was not safe. 10% admitted to being in a situation they were encouraged, pressured, or forced to exchange sexual act for money, drugs, food, or clothing, or protection. And nearly half of those 10% said that they were still in those situations. So being like, this is trafficking, or this is an unsafe situation, regardless for young folks. The most common reason for being homeless, which we asked kind of at the end of the survey, was family conflicts, or access to work, right? So access to a job. Job training, very important, right? And we want to see people on like a healthy trajectory to a career that can sustain them. But a job is like the overwhelming response. Any kind of job is the most overwhelming response that young people give us for this kind of reason. Transportation, you can imagine that transportation in our state might be a challenge for all kinds of folks, right? It's centered in urban areas. It's organized through transit districts. The transit districts don't necessarily work with the DSS office, the Department of Social Service office districts, or the court districts. It could be very different. In my area, in Eastford, or those towns way up in the northeast corner, the closest Department of Social Service office is in Willimantic, and the transit district does not serve Willimantic. So there's no access on public transit for folks to access like the basic needs that they might want, like food stamps, or health insurance, or cash assistance should they be eligible. So yeah, transportation, and then homeless and housing instability affects students from urban and rural, both these things. I'm not gonna say equally, but we know that rural students, even though they're more hidden, are experiencing a lot of these same problems, or a lot of the same experiences that folks in rural areas are experiencing. So it's easy in our minds to be like, oh, the city living is different than the country living. And it is, right? It's quieter, but it's also very similar, right? And we see the same thing. So I would just insist that you don't draw lines around the experiences of people in urban areas or in rural areas, and really just think openly about what's happening, how can we get assistance quicker, how can we identify faster, who are our allies and partners, who should they be, and what can we do now to make sure the system is responding faster. Cool? Any questions about this? So we surveyed, this was like over 30 colleges and universities. We did all of the community colleges in the state. I'm not sure about our footprint here at Tunxis. I'll have to look and see how many we had surveyed here. But we can learn a lot not only about Tunxis as a community and what's happening in Farmington or this greater area, but then when you start to look at your allies or your partners at Three Rivers or Quinnebog Valley Community College or Northwestern, right? Or Naugatuck, like the experiences are really similar. Or Gateway, right? Gateway College outside of New Haven had the highest rate of housing instability for the students that we were able to survey. So we can learn a lot. And we want to use that. We don't want to just hold this information or do a pilot. We know that this is happening, and we want to work with colleges and universities and all of our partners to figure out what are the steps that we can take to make the system stronger for college students. And then I would be remiss, and I'll just go into a little bit of an advertisement. Next week, and I've shared this with Marie, we are doing a training on the 15th in Middletown. I think it's at Middlesex Community College, that is about bridging the gap between the contacts that young people have in secondary schools, called the Mckinney-Vento Liaisons. Has anyone ever heard of a Mckinney-Vento liaison? No. So these are the people that every school district has to have that are dedicated to making sure the terrain is equal for all students, and even those experiencing housing insecurity. So we're trying to train those folks about what we're doing and how the system operates and what they're struggling with, because we know that schools are struggling all the time, and physically introduce them, and introduce content and training that's specific to the continuity between secondary schools and the McKinney-Ventos and points of contact at colleges and universities who are addressing the same thing. So how is it that a senior in high school they are able to make it out of high school and graduate, even though experiencing a housing crisis, has the opportunity and a connection, like a warm handoff, to a person at college level that makes sure that they're taking into consideration what they're dealing with or what they've dealt with, and how they're stronger, and how the terrain for them is equal to their other peers, right? That's the training that we're doing on the 15th. It's the system of points of contact for colleges is not really established. It's a little fitful or fledgling, but it's very important. And the continuity for young people between secondary school, should they want to go to college directly, needs to be there. It's a national best practice. It happens in other states, right? So we need to step up our game in Connecticut. It's just not acceptable that we're not making those linkages more known.
I sent out the email to faculty and staff at Tunxis.
Yes. Great. Great. And I can, and if I can help, if there's more staff than we have budget for, then let me know about that. All right, I think I'm almost there. So here's what we've done. I talked about the system. I talked about a little bit about data and about what we know, and how what we know it's challenged, right? We don't know the whole of the universe. We're only looking at kind of parts of the universe. But what we've done around the youth system of services is we've created some specific groups within each region of the state. For homeless services, the state's divided into 7 regions. They're called coordinated access networks. And within each of those networks, we have a Yeti, which is a fictional beast over there. I'm not going to go into it. But it stands for Youth Engagement Team Initiatives, right? These are groups of not only homeless service providers, but our college partners, our school-based partners from secondary schools, our youth service bureau partners, and youth service bureaus are nearly in every town in the state. The Department of Children and Families, Court Support Services Division, the Parole and Probation Department connected with corrections. We are convening these groups of people who are concerned with the experience of young folks, including minors, but also 18 to 24, to just have better awareness about what's happening and collaboratively working to strengthen the system to make sure that it's What are the 3 words that usage says? What are we trying to do for homelessness? It's rare. It's brief and non-recurring. So we're trying to make it so the experience is rare, brief, and non-recurring for minors, well, for everyone, but particularly my focus is for minors and for this 18 to 24-year-old. So how can we do that? We need partners all over. So here's what Yetis do. And here's ways that, the college community can be involved with the Yeti. We do have partners from Manchester Community College who comes to the Yeti meeting for Greater Hartford, and who's been really active in the youth count. We want all partners around the table to engage in the youth count. It's one way that we collect data. It's not the cleanest way methodologically, but it's one way that we do it, and we're one of the only states that do that. We want Yetis and we want the broader communities to understand about coordinated entry. So through each of those 7 regions of the state, there's a point person and there's a way, like if you called 211 right now in Farmington and you said you're homelessness, you would be directed to a person that's probably in Hartford who would set up it'd be a phone call first to see if you can get an appointment, and then you would actually be pushed into Hartford to see if, to be assessed and see what your need is and how acute that need is. So we want more folks to know about how that system works so that they're not, in Ellington and not understanding the way this system operates. We want to coordinate outreach efforts. The bottom line is all of our work has to do with outreach and identification. And how is it we've identified partners who can work actively, or more partners and work collaboratively to be able to identify youth quicker. We want young people, or we want youth service bureaus to know about the coordinated access process. Mapping assets and prioritize youth for services. So one of the things that Yetis do annually, and it's usually around organizing for the youth count, is create an asset map. What resources are available in what towns, and how can folks access them, and share that kind of broadly. Most of that information lives with 211, and this isn't about creating a separate resource book for every town in the state. It's more thinking broadly and comprehensively about what partners are we missing that should be at the table right now. Right? In other places, youth service bureaus are really strong. In Norwich and in Naugatuck, and in East Hartford, the Youth Service Bureau is fantastic. But how can we make sure that the level is raised for all of our partners all over the state? And then actively look at data, even though what we know is only a fraction of what might be out there. Look at the data that we have and review it and see how it is that we're tracking towards addressing and ending youth homelessness. Yes? Is there a reason? So the question is there a reason why we count in the middle of the winter? So there's a reason that PIT is done in the middle of the winter, and the assumption is that if you are outside in January in Connecticut, you really don't have a place to stay. And so we count people who are outside on that night before the youth count starts, and then we take a total of everybody who's sheltered in the state on that night, and that is our unsheltered and sheltered, literally homeless population, right? If you're in shelter, you're still homeless, just so you know. That is not a home. So that's how we do that. The youth count, we just follow on the heels of the PIT because there's a awareness statewide about this. Other states or other regions that do specific youth counts, they might do a shorter version in the summer, right? And then they might do a longer version in the winter. We haven't done anything in the summer because all of our provider friends are exasperated. And if I ask them to do one more thing, something bad could happen, is all I'll say. So we have one survey. It's considered a longer survey. but we're sticking with that right now. So that's like kind of the reasoning. It comes from housing and urban development sets the mandate for this to be done, and the youth counts kind of just follow the point in time count for kind of that same reason. But I agree, not really the best if you're looking for masses in January. Cool, yes.
Okay, I know everybody's probably sick of hearing me by now, but I worked with the Yeti group, and I just had this idea. I've wanted to get housing into the 2-year community colleges. I know it's crazy. It's like never been done. It'd be a precedent. But what if we had a college liaison for homelessness prevention from Yeti or CCH be the warm handoff from students coming from broken homes or toxic relationships or bad living situations? And then we had at Norwich and Naugatuck and East Hartford, where your partners are, the impact investors. So I went to Reset and Leadership Greater Hartford's impact investing talk yesterday from 8 a.m. to 10 a.m. There was just a lot of information there about people who want to make a social impact. So what do you think about that kind of connection idea?
I think that's a great idea. It would be a challenge for someone from CCH, but I could absolutely identify someone from the Yeti, right? A provider from the Yeti who's actually, I don't provide one service. I'm so grateful to be able to talk to you all, but I don't provide one housing service, nor do I do outreach. I troubleshoot all over the state for like what should be happening, but what I would do is I would say, in the Yeti for this area, who are the leaders of the Yeti? And I would make sure that those folks were the contacts for college students, right? So it's Rochelle Curry. She's from The Connection. She's fantastic. There's a new gentleman who just came here from Colorado working with the runaway homeless youth in Denver and Boulder area. His name's Chris Venable. He works for Journey Home. They're fantastic. So these are the folks who are on the street level now, and they're working with shelters, with outreach workers, with service providers. Those are the folks who should be like the warm kind of handoff or the contact person. So I think that that's a great idea. And I want like, when CCH, when we think about colleges, not necessarily community colleges, but colleges in general, there's an awful lot of housing at colleges. Like we could be doing more to house young people experiencing crisis. And I'm not talking about, I'm talking about anyone, like Goodwin, for instance, has some housing available. How is it that we could maybe create like some shared housing through higher learning for a region, for instance, very simply? Like, could we do that? I think that we could. This happens in other areas. So more like crisis beds, like emergency response. So I think I might be almost done, but I did want to say one other thing about minors, and that is, well, there's our plan. But I'll talk about minors just here briefly. Like, we've got crisis beds for 18 to 24-year-olds. There might be a 200-person waiting list in New Haven for them, but we do have shelter beds available in different places for that cohort. But for minors, there really isn't a lot. And so when I'm up here and I'm saying we need to identify minors and we need to make sure it's rare, brief, and non-recurring, there's not a lot of crisis beds for minors. So a lot of the pushback that we get from community members, and rightfully so, is like, so I identified a 16-year-old. What are you going to do? Like, what are you going to do? Now that we've made the universe bigger, we've expanded what we know with outreach and with more partners. Now what are we going to do? And I just want you to like think about this. It could be a philosophical thing for you to think about, like, but we want to make the opening door to services for homelessness as broad as possible. And I think it's important for us to know the scope of the universe of people experiencing this, even though we don't have all of the resources for them right now, right? It means that we need more runaway homeless youth providers that work actively with the Yetis, right? Or all over the state. Or it means that maybe we don't necessarily need more crisis beds, but we need some more flexible housing for young people. Because when you're 16, you can't sign your own lease. maybe you could if you were emancipated, but it's tricky, and these things take time. So if you're responding to a 16-year-old in Torrington who's under a bridge, like we did last week, there's not a lot of options for that person, besides for family or besides for child welfare. And so short of those, what are we going to do? So I just want you to know that it hasn't escaped me that I'm saying we have to make the system stronger, but you should know that the system for minors and the coordination of services for minors, it's very weak. And we're just starting as a state to really think about this and to wonder, and to share information with school districts, right? Like Vernon, for instance, I know the Mckinney-Vento from Vernon, which is a small town off Route 84. In June, they had 30 families that were known to the school district who were experiencing homelessness. So I don't think any unaccompanied minors, but 30 families, that's a pretty good amount. Sometimes these things resolve over the summer, sometimes they don't. Families move, things change, come back in the fall, and they have 38 families who are experiencing some type of crisis. So how can we work with schools? Like, we know that school districts, secondary schools, and colleges and well, some universities, but colleges as well, they're dealing with these problems all the time in silos. And that's not that helpful because the rest of the system doesn't know what they're doing, right? So we need stronger links with Mckinney-Vento Liaisons in all of the school districts. We need school allies all over to be able to let us know like what this population is like so that we can advocate for more resources at different levels within the state. I don't think the answer isn't emergency shelter for young people all over, because there's crisis beds right now in New Haven for 15 to 17-year-olds that aren't taken. So there's not that many of them out there, but I don't want to hear any 16-year-old that has no other option besides for staying outside, right? Or child welfare and not going back to family. Like, we need to create some positive alternatives for young people. So the plan, I won't go through this because I'm probably sneaking up on some time, but we want to be able to identify everyone. We want to be able to divert, if possible, young people and families from shelter, if at all possible. We use coordinated entry as a state, but we want to make that system stronger. Not everybody, particularly young people, want to call 211. So what are the alternatives that we can institute there? It might be like a warm handoff to someone from the Yeti. Move into permanent or non-time limited housing options. This is a huge challenge because there's not a lot of these options, particularly for minors or for young people in general. And then we want to also have an eye to the future, because although I think we're creating a system that is addressing homelessness at the moment, we have to consider that these instances of homelessness are going to continue to happen and plan for future events, right? Yes?
You just mentioned that we should change the system, right? Can you explain that?
System change. So I just think that we need to make, for minors, so there's almost like two different things here. We need to make sure that 211, there has to be some options to 211 is one system change that I would say. What's that?
Like a list of options?
Well, yeah. Well, yeah, a list of options. Or is there a way, I mean, because sometimes if you call 211, there could be we know that there's wait times involved for folks all over. And particularly young people they're skeptical of like bureaucratic phone systems, right? And me too. So what could we do? Could we have like, what's that?
You know, like sometimes when you call like insurance companies or whatever, they tell you, would you like us to call you back? You know what I mean? Instead of you waiting.
Or like textability, or how can we have another resource that's outside of 211 but regionally located or identified that could help a young person specifically? Like people with knowledge about this specific system of services for young people. That's not, it could be 211 driven, but we know that we need to advertise and create something that's separate, like parallel, but distinct, right? What other system change? Less reliance on shelter, like still crisis beds, but less reliance on shelter. More flexible kind of exits for any young person, including minors, right? A stronger connection with Department of Children and Families. So a youth who is 17, who's like, yeah, I have DCF contact, but they never called me back, or they said that I wasn't eligible. Like, could we call DCF to verify that? Right now, it's like the care line it's a circuitous route to get that. So can we have some like stronger connections for advocates to child welfare? That could be a system change. And again, system is like commissioner level, social worker level, like we need to make all these things meet. So that's like, I should be able to think of more, but that's a handful. Yes? Oh, so the Yeti, yes. We need funding. So one positive thing is that if anyone's heard of the Melville Charitable Trust, they are trying to help Yetis around the state right now with funding. Yetis as they exist is kind of a brainchild of the coalition, and if we ask them to do any more things, again, I'm worried for our safety. But it speaks to realizing that there's a problem within the system and then taking steps to make sure that we have like real solutions that are not time limited, right? Or relying on the goodwill of volunteers, which is what we're doing at this point. Like youth service bureaus, we're just reeling them in because they work with young people and we need them. But they are looking at us like, are you kidding me? And school-based, like Mckinney-Ventos and people within school districts are like, I can't do another move. Why are you asking me? So you're absolutely right. Like it comes down to a level of how can we fund particular components of the system really wisely? And then how can we ask natural allies to step up and help us?
Okay, I think we're just about out of time, but don't go. Don't leave yet. I have something to say before I thank Mr. Asikainen for being here. So one way that you can help, and by that I mean help yourselves and assist with eradicating the problem of homelessness, is to look into the Civic Engagement Certificate that we offer here. So just let me take a minute to explain what that is. So you take 5 courses, including American Government, U.S. History, 1, Principles of Sociology, you may have those courses already, Composition is another, Intro to Human Services, or Intro to CJ. And after those 15 credits or during, you can complete an internship of your choice. And the internship is 3 credits that the Civic Engagement Institute pays for you, so you don't have to pay for it. And I happen to know that there's an internship available with Mr. Asikainen's group. So we were talking earlier, and if you're interested in that, I can promise you one thing: you will not be bored. You'll be put to work. There's plenty to do in terms of gathering data and all the other things that were described in the presentation. Please don't think that if you volunteer, that takes away from your own academic success. The two are so connected, and we have the studies, we have the data to prove that. The more you do for your community, the more likely you are to do well for yourselves. Don't forget that. Okay, just take that with you. If you hear nothing else that I have to say, take that with you, because it is very true. There's a mutually inclusive relationship between volunteerism and furthering your own careers. So keep that in mind. I also want to thank Mr. Asikainen for being here. It was a very good presentation, as I knew it would be. So thank you very much. I have a card if you're interested in more. You can have my contact information. You can speak to Mr. Asikainen too.
Thank you.
So thank you all for coming. I appreciate it.